Jordan. My name's Ryan. I'm going to be a nurse today, and this is Danielle. She's going to be assisting me in today's procedure. Can I just check your wristband really quick?
Yes.
Okay, so can you verify your name and date of birth?
Jordan Janello, March 29th, 1995.
That is perfect. Okay, so today I'm just going to log on to the HR. Your doctor has ordered packed red blood cells if your hemoglobin was under 8. And I just checked your labs and they are because of your chemo yesterday. So we're going to be administering you with packed red blood cells in a little while. Do you have any allergies?
No.
Okay, perfect. And then before we can administer the blood products, I do have to do a set of vitals really quick. So I'm just gonna put on gloves, perform hand hygiene, put on gloves.
However, I'm gonna discontinue.
Or is she just expecting us to pretend that the whole process?
Well, we're gonna do both. We're gonna do a video. You want me to pretend to do this video like I would?
So I would be taking the apical heart rate for 1 minute.
And I need every identifier
1 minute.
here for prep.
I'll be doing a respiration.
She'll be doing a respiration rate. I would also take blood pressure. I would do the pulse ox as well as a temperature. And then they would all come out to normal ranges.
What you asked me to do was
Gloves.
properly administer blood and record it. And if you want me to properly
Right.
administer.
Also, one last thing. I'm looking at the consent right now. Are you still okay with taking blood products today?
Yes.
And then, do you have any further questions about the procedure that's going to be happening today?
No.
And can you just verify that this is your signature on?
Like, is she stopping
Yes,
at the
that's me.
centrals, or is she gonna stop
Okay.
at?
And then the phlebotomist will be in a little bit to draw your blood, to cross-type it with the donor, and then we'll be back as well to do some formalities with the blood products. Hand hygiene.
Hi, Jordan. My name's Danielle. I'm here with Nurse Ryan. I'm going to be drawing some blood today for your transfusion and to verify
I mean,
your
we just
blood
wanna
type.
go, we can start another video from.
Can you verify your name and date of birth?
Jordan Janello, March 29th, 1995.
Okay, thank you. I'm gonna put on gloves.
There's no cap on that?
Just pretend.
See the blood.
The video we have is fine.
Just talk a little louder.
When it
So,
hits you too.
and then once I receive the tubes, I would put 2 patient identifiers, the name and the date of birth, my initials, as well as the time that the sample was collected.
Here, watch it with me.
And then I'm going to have the wristband and I'm gonna put the patient's name and date of birth and the facility's identification number. And I'm going to take also the barcode so Ryan could label the tubes.
And then I would stick them on the tubes, put them in a biohazard container, and then send them to the lab.
And the patient would get the wristband.
Hello, Jordan. It's Ryan again. I'm here with your blood. We're just gonna do a few quick checks, and then we'll be administering your blood. Okay?
Okay.
All right. And then this is also Danielle. She'll be helping me doing the checks. So first, before I do some checks, I'm gonna take another set of vitals and record those just to make sure that everything's okay. So you would do respiratory rate. I would do apical pulse for a minute. I would do blood pressure. I would take the temperature and then do the Dynamap to do pulse ox. Okay, and then we would record the vitals on the paper. Okay, and then we would open the blood of the blood bank. So here we have AB negative blood for Jordan Janello, last name G-E-N-N-E-L-L-L, and then first name J-O-R-D-Y-N. Birth date is March 29th, 1995. The unique ID code from the bar scanner is 1, 2, 3, 4, 5, 6, 7, 8, 9. And then on the back, just check for me that it's 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, perfect. And then we would hang this bag and then get ready for infusion. Okay, so I would first, before administering, check the patency of the IV line. So I would clean the hub with an alcohol swab for 20 seconds. This is a 10 cc for all intents and purposes. I would flush with normal saline to I would assess for any redness, swelling, any adverse reactions, any pain, and it is fine. So then I would open my tubing, my white type blood tubing. Put it off. I would first
Yeah, did you guys sign,
Spike.
make sure you guys sign the sheet.
the saline. And I would completely fill the filter chamber. Okay. And then I would shut off that to the saline. I would next prime and spike the blood. I would open the blood. Okay, come on. There it is. Okay. Then I would open the line. I would again clean the site with alcohol, the hub with alcohol. This is sterile because there's the cap on it. I would attach that. Well, I would prime the tubing first. Open it up. Oh, right. That didn't happen. That was totally intuition. But okay, the tubing is now primed with the blood products. I would clean the port, the hub, and I would attach it. And I would let it transfuse. I would stay with the client and assess vitals again. So I would assess vitals 5 minutes after the start of transfusion, and then as well as every 15 minutes while the transfusion is going. If there's no adverse reactions, I would make sure that I just open the tubing and make sure that it gets transfused within 4 hours.
Done?
Is it recording?
Yes.
Okay. Jordan, before I go, your vitals are good. You're doing well with the transfusion. I just want to make sure that you know to look for, like if you feel feverish, if you're sweating, if you have any pain, if you're dizzy, nauseous, if you're short of breath, or just watch out for those because it could be an adverse reaction to the blood products. I just want to make sure that you know to report those symptoms.